In a world where we are constantly connected, yet feeling increasingly disconnected from ourselves and others, mental health has become a pressing concern. Mental health affects us all, regardless of age, background, or socioeconomic status. As the world celebrates Mental Health Day, Healthmed Hospital 98 Sanga Close, Uyo Akwa Ibom State, Nigeria, organizes a mental health awareness campaign to promote healthy living among its immediate community. The event, with a theme, Protect Your Mental Health, brings together health experts and participants to discuss crucial topics related to mental health. Here is Mrs. Comfort Okabio, Chief Executive Officer, Healthmed Hospital.
Mental health is a very, very serious health condition or challenges. Unfortunately, that is the one that has been neglected the most. So for the World Health Organization to say we should use month of October to speak about it, I say I love helping, and I'm sure all of you love helping. Let us see what we can do so that people will know that it is not a life sentence or because you've committed any offense.
The sensitization exercise explores connections between biological, psychological, and social factors which lead to anxiety, stress, and depression, equipping participants with valuable resources and information to enhance their mental well-being. On hand is Dr. Idoroyina Kwabio, a psychiatric doctor who is based in Cape Town, South Africa.
There is no health without mental health. And as life is going on, we see, things are getting hard. Economic pressures, food security, shelter insecurity, there is loss of life, etc. Different demands on the individual. And all of this can contribute to difficulties with mental health. And specifically in Nigeria, we have a high burden. We have low awareness and high misconceptions about mental health.
In the area of mental health, a psychologist's role includes assessment and diagnosis, psychotherapies, and more. Ms. Zura Bong-Tom, a psychologist, has this to say.
Assessment and diagnosis, that is one primary duty of a psychologist. As a psychologist, we work hand in hand with schools, we work with families, and not just diagnosing it. We tend to try to see where these individuals are coming from. To talk about the role of psychologists in managing the mental health or the psychological issues that comes as a result of coming directly in contact with this pressure that we face every day. Old or young, boy or girl, educated or not, every one of us has issues that impact massively on our own mental health. A psychologist will help you to open up, to vent out what you are passing through, and then you are fine in the long run.
Prioritizing mental health is by loving oneself, being physically active, minimizing alcohol intake, engaging in meaningful and enjoyable activities, and seeking support from trusted friends, family members, and health professionals.
There is no health without mental health. Mental health affects our mind, our memory, our thinking, our thought, and everything. And when it is bad, you find out that the ability to think, to plan, to judge, to reason is bad and things like that. So that is why we should be very careful and be focused and be serious about mental health.
I just want to encourage us to take care of our breast. The best treatment to breast cancer is prevention. Prevention and early detection. So how do you prevent it? Be aware that there is something called breast cancer. Whatever comes out to present or manifest itself in your body is because of what you have taken in. You want to live a healthy life, eat healthy. That is the first thing you do to prevent breast cancer.
Some participants in the event, including the immediate past chairman of Mbo Local Government Council, Right Honorable Mary Joatang, and a former director of programs, Akwa Ibom Broadcasting Corporation AKBC, Edeme Wanodo, expressed their feelings towards the awareness campaign.
I have come to know that mental health is very, very important. It's not all about people that are mad, that even healthy people do have mental issues, even young people, old and all that. But I know that it affects parents and elderly people the more, because maybe pressure of social life and so many things. And so because of that pressure, they may be behaving differently. Marital issues may emanate from mental health, because when you have, accumulated issues from maybe environment, maybe school fees, having to meet needs and all that, and then accumulate, so we cannot really meet up with our demands.
People who have health problems, mental health problems, are always stigmatized. It is not good to do so. For instance, people may think they have good health. They may not have. If you don't have good mental health, it means you don't have good health at all. So it is good to take care of your mental health.
We have been told, anyways, that going to a psychiatrist does not mean that you are actually mad, but you are going for checkups and taking your siblings, your family members, and your children down for checkup at least yearly or monthly is a good one.
For people that are depressed, the best place to go is to seek medical attention. It's for them to go to hospital first. See the specialists that God has given them the grace, the wisdom to know how to handle the case.
Mental health is a journey, not a destination. By working together, we can create a more compassionate and supportive world.